Do you know what is the biggest threat in this coronavirus era? The biggest threat is it is affecting the people with chronic disease, specifically with diabetes. Now, why specifically with diabetes and why with the chronic diseases? One who is suffering from chronic disease actually have his immunity compromised. The one thing is because of a disease. Second thing, because of medicine is taking. And the third, maybe he's just going beyond medicine and taking something like steroids or immunosuppressants. In diabetes, people tend to take medicines for 5, 10, 15, 20 years or even lifelong without a cure or without even an expectation of a reversal, meaning that they are not getting treatment. They are trying to control the blood sugar levels. But in this quest of trying to control the blood sugar level, what really happens is disease continues to grow slowly, gradually over the period of years. As as disease continues to grow over the period of years, the immunity actually is coming down and down and down because as the disease grow, the immunity comes down. As the disease grow older and senior inside your body, it actually compromises immunity. And diabetes, as you all know, is a disease which reduces healing ability. You can see if there is simple pinprick also, the healing may be a problem. If you fall and get a roadside accident, healing may be a problem. If you do a surgery, healing may be a problem. So one important thing is that the healing ability and immunity is already compromised in diabetes patients. Second important, the tendency to catch infections. It can be because of the factors mentioned right now or otherwise as well because it is a sweet disease. It is the sweetness of the blood and sweetness of the whole constitution actually is a point of attraction for bacteria and viruses, so it can catch secondary infections very easily. Third, and the most important, coronavirus seems to be killing diabetics more than anybody else. Out of the, if we just go do analysis of all over the world deaths of the coronavirus by coronavirus infection and the severe infection, it is usually found in patients of diabetes and high blood pressure or heart disease and other chronic diseases. Actually, other chronic disease data is yet to come, but diabetes is the very high risk for death due to coronavirus infection. So I want you to be safe about if you are having diabetes or if you are having anybody at home who is having diabetes, which usually everybody have. So if you have some patient of diabetes at home, somebody taking anti-diabetic medicines at home, you need to be extra cautious. You need to take extra precautions because if you don't take extra precaution, coronavirus is going to be very harsh on diabetes. So maximum death rate is in patient of diabetic. Therefore, the right approach taken by diabetics can actually save their life. So I know whole of the world is taking care, whole of the India is taking precautions, but if you have somebody with diabetes, the diabetes person needs to take extra precautions. He needs to self-quarantine, wash hands, use mask, whatever he wants to. He needs to take extra precautions. Plus, the people in their vicinity means you and all the relatives all your family members, they also need to take extra precautions because if anybody brings coronavirus home, he will not be affected badly, but probably the person having diabetes will be affected badly and maybe even prove to be life threatening, maybe even prove to be fatal. So diabetics need to take extra care. I am going to suggest some different routes by which diabetics need to take the specific medicines for that. See, in general, there is a news in all over that arsenic album, the homeopathic medicine, is announced by Ayush Department, Government of India Department, as a preventive for coronavirus. But is it good a preventive for diabetics? The answer is no. For diabetics, we need specific protection, not a general protection. And there is a major difference between general protection and the specific protection. If we talk of general protection means taking ourselves and the job is done. You are 80 to 90% protected. Specific protection means the specific protection is for those people who are suffering from any disease, not just diabetes. So if anybody is suffering from any disease, apart from diabetes, even cancer, kidney failure, liver failure, you cannot go along just with the general protection. You need to go meet a homeopathic doctor, a proper, scientific, well-versed, experienced homeopathic doctor to get your complete detailed case study done and select a specific medicine for you. This specific medicine, called as the constitutional medicine, is actually the most specific immunity for you. You need this kind of medicine, the specific medicine to develop your immunity. One. Second most important thing, most important thing, this medicine will develop a specific immunity. But why you want to restrict yourself to save from corona infection? Why don't you want to save yourself from kidney problems, future heart problems, eye problems, brain strokes, and liver problems, and whatever complications of diabetes like thrombosis of legs? Even many of the patients have to go for for the amputation of legs. So if you are diabetic, my question to you, do you want to save yourself only from corona, or do you want to save yourself also from complications of diabetes? Then here comes the golden opportunity. If you or any brother is having diabetes, go for a right treatment. See, right now at this moment you are not taking a right treatment. What you are doing is desperately trying to control the blood sugar levels. And you need to be very careful, because a very high hyperglycemia as well as a hypoglycemia, both are dangerous, both can attract coronavirus infection for you. But now, as we have talked about specific immunity, now we are talking about how you can save your life by reversing diabetes. Oh my God, you must be asking, can diabetes be really reversed? I hear a lot of noise from all over the world that he can reverse diabetes, he can reverse and cure diabetes. Let me answer. I'm a doctor. I'm a doctor. I'm a qualified doctor. I can assure you that diabetes can be reversed. Now, how far? It all depends from person to person. See, you may respond differently from others, and other may respond differently from the third one, and all three may respond completely differently from the fourth one. But with my 25 years of experience as a genetic health expert, I can tell you, with the genetic root cause treatment, we can reverse your diabetes. And when we can reverse your diabetes, you can actually be saved from all the future complications. See, now you are taking care about your health because corona has come as a storm. But many more people have died because of complications of diabetes than by coronavirus. Why not take a right treatment? So here I welcome you. I invite you to think about taking advanced genetic holistic treatment which can reverse diabetes, even at times cure diabetes and save you from all the complications of diabetes, at least minimize them to give you a very high quality of life. So think about it, and if you think you need this treatment, there is a link of getting personal consultation. So please just mention it. Please mention all your details. My team will get in touch with you. You can book your free consultation right by mentioning in the comment section as well. Thank you, my dear friends. Thank you for watching this video, and thank you for thinking about protecting you from corona infection and also protecting you from rest of the complication. Thank you.